Welcome to today's Q&A, and today we're talking with Dr. Hector Izquierdo from IVF Spain. Welcome.
Well, thank you, Andrea. I'm very happy to be here. I'm always very enthusiastic and happy when I can take place in one of these moments we have to teach patients about reproductive medicine. So thank you for the invitation.
Dr. Hector, we received some questions about ROPA technique, and I thought you'd be the ideal person to help clarify these questions. And the first question is whether couples can choose who contributes with the egg and who actually carries the pregnancy in the ROPA technique.
So first of all, I want to say that I was thrilled when I got these invitations. There are many topics in reproductive medicine that make me very happy, but ROPA is one of those things that I have very near to my heart. Most of it all because of personal situations and friends. And the thing with the ROPA is that it shows how important are women in reproductive and fertility treatments. And having two women in a treatment, it just increases the potential and the capacities and the possibilities that we have available. To answer this first question that you made, what I always say my patients when you come to me and they want to speak about this is have an open mind, because we shouldn't decide based on what I want, what I should do. We need to see this like a team. And in every team, you need to choose your team workers so they can do the best they can, so the team in total is the best possible. And this is how I see it. When I have the girls in front of me, I sit with them, ask them their previous history, and based on their scans, ultrasounds, and tests, with that information, we decide which could be the best egg provider and which would be the best to carry the embryos. Because that's the situation. We have two pair of ovaries and two uterus that we can mix as we want or we decide the best. So they can actually decide themselves, but I think it's better if we come with the idea, okay, let's see how we can benefit the most here. Because sometimes the one who wants to carry the babies is perhaps not in that good condition in the room, but has perfectly ovarian reserve. This is something we rather look a bit open, because at the end, both are taking part of the process and both are doing their part. So it's easier if they come with open mind and open to hear what's the best option and then to move forward. If they don't, it's still possible that they say, I want to be the mommy that gives birth. I want to be the mommy that gives the eggs.
Okay, perfect. So if we have already eggs and we have the uterus, we still need the sperm to make a baby. How do they choose the sperm donor?
This is a very important thing. And this is something that characterizes Spanish in fertility treatment and is chosen, and the patients does not go together. We need to remember that the legal frame in Spain does not allow patients to take part of the choosing process of the donors, either sperms nor eggs. This is for two main reasons. As you know, donation in Spain is anonymous. Therefore, it's pretty funny to ask someone to choose something they don't know anything about. This is not easy, this is not makeable. And the second thing is because there is something that has with human race a context, and this should be a donation. And something you get donated, you don't choose. But because if you choose something, then you're not getting something donated, you're purchasing something. And this something you're purchasing is actually part of a woman, a man, or a woman herself. That's why this is something that in Spain is strictly legally restricted. They say if we get the patients to choose their donors, we're at the end a little bit selling them people or parts of people, but you shouldn't. The Spanish law is very clear. And this is something that in the ROPA method, it's fantastic. It helps the best and is. In Spain, the woman who's receiving the donation is the one that tells us how the donor must look like. It means if I need to get an egg donor for Andrea, I need to book someone who's pretty much Andrea's twin sister. And if we need a sperm donor for Andrea, his one needs to be also his twin brother, to say it in some way. What does it mean? That in the ROPA method, in the ROPA technique, if the other girl is given the eggs and we're looking for a sperm donor who must by the law look like the one who's receiving, the baby at the end is going to look like a mixture of both mammies. And this is the legal situation in Spain, which in the ROPA technique is fantastic. In other situations, not that much, because let's say you were married to a Scandinavian, 2-meter, blue-eyed, white-skinned, blonde-haired guy. If you need, as a couple, a sperm donation, the sperm donor is going to be like you, not like him. And at the end, for the family, that's not going to be the best. But in the ROPA technique, it suits perfect, because the one providing the eggs is already providing her looks, and the one who's carrying the pregnancy needs to get the looks from the donor who looks like her. From the point of view, it's pretty fantastic.
And when the baby is born, are they both registered on the birth certificate as moms? Or?
This is a very, very important thing, and that has nothing with the process in Spain to do. Most of the countries, they do not acknowledge the origin of the gametes to give the baby paternity or maternity. In most of the countries we work in, the mother or the father of the baby as those who give birth to the child. In this case, the mothers of the baby are those who give birth to the child. And in some countries, like in Germany or in Spain, if the couple is married, they're both right away mother from that baby that's been born, independently who made what to get here.
Wow.
If they're not married, in most of the countries, what they need to do is the mommy who's pregnant needs to go to the jury, to the court, with the, or to a legal notary, for example, and they'll say, okay, I am the mommy because I'm pregnant, but she's also the mommy. And she acknowledges that she's the mother, and the other accepts that she's the mother. And after that, the baby who's given birth is automatically the baby of those two mothers.
Okay. So it's a process, but it is possible, and eventually they both get it.
It works automatically if you prepare in advance, and it's very easy. It's very easy. In countries where the homosexual marriage and partnership is acknowledged.
Yeah.
In those who are not, then
it's more difficult.
It's more difficult. But this is in Europe, very less countries that are so back behind.
And what are the success rates with ROPA method?
Very different. Speaking about ROPA method is the same as speaking about fertility at all. You have two women, and depend on the ages, the situation, what they've done before. Most of the times, what we need to say is that the ROPA technique patients are much younger patients, are patients that otherwise have a couple from the other sex and would have gotten pregnant without having to see the doctor at all. They don't have sperms is the problem that normally, usually they have to get pregnant. And in this perspective, sometimes it's very easy. It's just making a stimulation, fertilization of those eggs, and those have very, very, very good pregnancy rates. On the other side, coming out or finding yourself takes nowadays not always less time. There are a lot of people that discover very late who they really are. And in this discovering, they find a family also a bit later. So in ROPA technique, or in heterosexual couples, if you are above 40, the chances are the same to move forward with your own eggs. So it doesn't, so that technique or the situation doesn't really affect either positive or negative. The only thing that helps is that you can always change it. This might allow you to have, perhaps, depending on what you do, a better success rate.
And is it possible for them to even take an egg from one, take the egg from the other and swap it?
It's complicated.
That's quite complex.
Yeah. Principally, it is possible for both women to produce eggs and freeze them.
Okay.
Then, to do an IVF cycle, when you fertilize the eggs, it's what's a bit trickier. How does this work? The idea in IVF in Spain is that I can produce embryos just if I know these embryos are going to be used for a pregnancy. Produce embryos just to freeze them is not legal in Spain. These babies have rights, and I must supply them the possibility of life. And I must be sure as a doctor that this baby has a rational success rate of being a baby. Then, if I have two girls and I do two stimulations with the idea of producing embryos from the one, embryos from the other, and then switch them, we know in advance that some of those embryos are not really going to get to be used, because if they're young, they might produce, I don't know, 3 or 3. You're not going to have 6 babies.
That's a bit complex. Yes.
This is what I mean. This is where the legal situation, the ethics, go near one to the other, and we must think about it. That from one point of view. And the second point of view, also ethics, making 2 women pregnant at the same time is not something we should do. The pregnancy is a beautiful moment. It's perhaps one of the prettiest situations in the life of a woman. That is also a risk. And then you might not want to put 2 women at the same time in the same risk, because who's taking care of the other one? Let's say if one is bleeding and needs to go to the hospital, who's taking care of the other one? It's putting you in a situation where the couple cannot support the other one, because he's at that moment, she's at that moment needed support themselves. So my recommendation is always one after the other.
Okay, perfect. And so if they have those leftover embryos, let's say they got pregnant with the first transfer, are they frozen for later then?
They can switch them. So this is, the principle is this. The reason why ROPA is not strictly legally described in Spain. There's no law that says women are allowed to do this and that. The principle behind is when you do an IVF cycle, the woman who gets the eggs is donating her eggs for her family, for her own purposes. And the man who's providing sperms is donating his sperms. So with her wife, with his wife, we can make a treatment. Okay? If that's that way, and we allow heterosexual couples to do so, why not the homosexual couples? The rights are the same. So one of the girls would be providing her eggs as a contribution for the
donation,
couple. And if the embryos are already there, the embryos are their family. In Spain, all the embryos are produced from a couple are from those both parents. Both are equally parents. So they get to decide how they want to transfer them. They are there. The important thing is they're used. We give them a family.
Dr. Hector, thank you so much for clarifying these challenging questions. They're a bit more complex than the normal questions, but I think it's important. There are questions patients have, so it's good that we were able to clarify them.
Always happy to do so.